conscious sedation. It's known as sleep density, sedation density, and relaxation density. Conscious sedation is a technique used to produce a minimal level of consciousness in which the child is able to maintain adequate airway and respond to physical and verbal stimuli. Therefore, the sedated patient is conscious. Why conscious sedation? It is indicated to control the inappropriate behavior of the child that may interfere with the provision of suitable dental care, to facilitate production of comfortable and efficient dental treatment, to use a positive attitude toward dentistry, eliminate fear and anxiety, and reduce pain. If you treated dental anxiety, you are sedation are mainly minimal or moderate sedation or deep sedation. With minimal or moderate sedation, a depressed level of consciousness in which the patient retains the ability to maintain patent airway, respond to physical stimulation or verbal commands. For deep sedation, there is a controlled state of consciousness from which the patient is not easily, partially, or complete loss of the productive. Therefore, the objective of conscious sedation to alter the patient's mood. The child became cooperative and it elevates the pain threshold. However, if the child is conscious, there is intact protective reflexes, stable and normal vital signs. There is anatomical and physiological differences between the child and the adult. Variation in size, weight, age, as a measurement of maturation of the system. The basal metabolic rate is higher in the children, which means that the oxygen demand is greater. Most of the children have hypertrophic tonsil and adenoid. Therefore, they had a greater risk for airway obstruction. They had a faster heart rate, lower blood pressure. Therefore, the effect and the duration of the drug is much more variable for the child. And the drug dosage for the children should be carefully individualized. The pharmacological agent used for sedation may be sedative hypnotics, anti-anxiety, and several routes of conscious sedation are available, may be intravenous, intramuscular, or subcutaneous, oral, rectal, or inhalation. These are various routes of conscious sedation. Each route has its own advantage and disadvantage. For the oral route sedation, it is the most comfortable and anxiety-free, but the patient should be instructed no solid food to be taken after the midnight before sedation. To maximize the drug and to prevent the advantage, it is acceptable and simple, convenient, ease of administration. There is decreased incidence of allergy. However, the disadvantage include the patient compliance, delayed onset, prolonged duration, and erratic absorption. These are common drugs for oral administration. For the intravenous route, have an advantage, efficient method in ensuring predictable and adequate sedation. It has rapid onset of sedation. It can be given in increments until the desired level of sedation is achieved. The absorption is not a complicating. The main disadvantage, it is not recommended below the age of 60 years. There is increased potential for complication. There is a period of post-operative recovery. Intramuscular, it means you have to inject in the upper lateral quadrant of the buttock, lateral aspect of the arm, or anterior part of the thigh. It is a faster absorption than the oral, doesn't require patient cooperation, but carries a risk of tissue trauma at the injection site. There is a delayed absorption than the intravenous. Subcutaneous injection of the drug beneath the skin. The main disadvantage, it may irritate the skin. The absorption varies according to the blood supply to this area. It has a slow absorption. Rectal route is indicated in a very young children or those who refuse administration of oral route or injection. It has a faster onset, rapid uptake of the. These are some examples of the drugs used for and its route of administration, doses required, and the side effect of each of them. Onset, duration, effects. As a guidelines for the use of drugs, you should take a detailed medical history to prevent undesirable drug interaction. Select the appropriate pre-medication, depending properties, effect, duration, and the dose. Patient consent is very important. Preoperative instruction. It requires a high level of personal training, assistant other than the operator, and post-operative care. The general causes of pre-medication failure: if you prescribe insufficient dose, accidental or intentional reduction of the dose by the parents, child failed to cooperate in swallowing of any pre-medication, expectoration, vomiting of the portion of the medication, children with the medical problems, inhalation analgesia. Nitrous oxide is the only drug used for inhalation analgesia. It is sweet-smelling, colorless, odorless gas, result in CNS depression, neither explosive nor inflammable, absorbed quickly from the alveoli of the lung and dissolved into the blood with no chemical interaction. It is heavier than air. It is indicated mainly in children with a short attention span, mild to moderate anxiety, frightened patient who wish to receive dental treatment, mentally handicapped or very young child. The main contraindication is upper respiratory tract infection, pulmonary diseases, nasal obstruction, claustrophobic patient with otitis media, patient with increased vomiting tendency, immunocompromised patient, cardiac patient, female and the advantage of this gas is to work well with a mild to moderate sedation. It has a rapid onset and recovery. It reduces the pain. Depth of sedation can be controlled. It is a safe agent. People recover quickly and return to the normal activity. Lack of serious adverse effects. Disadvantage: it is a weak gas agent. Lack the patient acceptance. في potential chronic toxicity, acute toxicity, as nausea, vomiting, headache, and may sleep. Preoperative recommendation: the child shouldn't eat or drink after the midnight prior to morning appointment. If the appointment afternoon, it should stop taking anything after at 6 o'clock a.m. The child may have a clear liquid up to 4 hours before the appointment. If any of these guidelines are not followed, the appointment should be cancelled. The machine for nitrous oxide has a flow meter, safe valve, reservoir bag, a reservoir bag, a light piece of nose, gas cylinders, and scavenging system. This is the mixture dial, flow meter tubes, this is the reservoir bag, and this is the cylinders. Light piece of nose, light piece mask put into the nose. First, you have to describe to the child in a simple words what he will feel. The child will feel tingling sensation in the fingers and the toe. He will smile and follow simple instruction. He open his mouth easily. Therefore, then encourage the child to breathe through the nose. Start by 100% oxygen and zero nitrous oxide for 1 to 3 minutes. Then increase nitrous oxide by 5 to 10% every 3 to 5 minutes with a final concentration 70% of oxygen and 30% of the nitrous oxide. Give local anesthesia. Then complete opposite treatment. The use of nitrous oxide didn't eliminate the use of local anesthesia. It just raised the pain threshold. Therefore, local anesthesia should be given. Terminate the visit, finally, after finishing all your operative procedures by 100% oxygen for 5 minutes to avoid diffusion hypoxia, since the nitrous oxide is heavier than oxygen. The state of analgesia is reached when the child feels tingling sensation. He smiles and follows a simple instruction. He opens his mouth easily. When this state is reached, local analgesia is given. Again, recovery from the analgesia is achieved by 100% oxygen for 5 minutes till the child regains his normal state. The adverse effect of nitrous oxide includes acute and chronic toxicity. The acute toxicity or adverse effect including hypoxia, bone marrow depression, neurotoxicity. The chronic effect for the dentist who exposed to the nitrous oxide more than 3 hours a week. There's including increased incidence of liver disease, bone marrow depression, spontaneous abortion, neurological defect, reduced fertility, and malignancy. The common problems and solution. There may be sleep. Could be avoided with a continuous communication with the child. It may induce vomiting. Use the minimum effective dose. Avoid prolonged procedures. Follow the fasting instruction. Slow return to upright position. Airway obstruction could be avoided by frequent repositioning of the head. Diffusion hypoxia avoided by 100% oxygen for 5 minutes by the end of the visit. As a safety recommendations for using nitrous oxide, use a minimum effective dose. Use a scavenging system. Vent the exhausted gas outside. Check the delivery system for any leakage monthly. Continuous monitoring of the dose is essential. General anesthesia. General anesthesia is a controlled state of unconsciousness accompanied by loss of protective reflex. The patient became unconscious through depression of the CNS, thus eliminating patient cooperation factor. It is indicated in extremely uncooperative child with extensive dental need, extensive trauma to the orofacial complex, severe dental diseases in a physically, mentally, or medically compromised patient, allergy to local anesthesia. However, it is contraindicated in the patient with impaired liver function and the kidney, upper respiratory tract infection, pulmonary diseases, respiratory obstruction, deviated nasal septums, elevated body temperature, lower hemoglobin value, healthy cooperative patient with minimal dental need. The pre-anesthetic assessment is very important through a detailed medical history and the anesthetist must be considered. The fostering instruction as previously in the control sedation. If the child under the age of 6 years, no solid up to 6 hours, no breast milk for 4 hours, and no clear fluid for 2 hours. While children over 6 years of age, no solid, no liquid for 6 hours before operation. Patients with a special need require pre-adjustment. Patients with congenital heart defect require prophylactic antibiotic. Bronchial asthma required bronchodilator. Diabetic children require stabilization and control of the condition. Children under steroid therapy require preoperative and intraoperative. The operating theatre. Child should wear on clothes. Local anesthetic cream should be applied before insertion of the cannula. You can allow the parent to be with his child during the induction. Patient should be called into the recovery room once the work is completed. For a normal day, recovery is a minimum of 2 hours after operation. This is the operating theatre and the insertion of the cannula. This is the patient under GA operative procedures. In a conclusion, GA represents a risk under any situation. Hospitalization can be a psychic trauma for the patient and the parent. No patient should be exposed to that risk without sufficient cause. Thank you.